Hey y'all, I just wanted to come on here real quick and talk about how I explain hypertension to my patients. It's so important. Being a nurse, I'm constantly meeting people and talking to them about their health status, and they may have no idea what's going on with them. Usually I'm talking to a kid of the person. So for example, I had a lady today. She got COVID super late, and so she came home and she had a bunch of kids in her house. She just got out the hospital, and the nurse is coming to talk to her about getting a home care program. So here I am oh, okay, so it looks like you got COVID. The COVID kind of debilitated her just like it does everyone else. But I had to explain what was going on. So first things first, high blood pressure. Everybody has a blood pressure, and the pressure is basically the blood going through the body by a pump called the heart, and it's the pressure that the blood pushes on the walls of your veins and arteries. And so whenever you squeeze the blood and stop the flow and you allow it to come back slowly, you can determine the pressure of a person's blood going through their veins. Typically, we want a blood pressure that's 120/80. That is universal. Even a low blood pressure, some of y'all think that 120/80 is good, and it is, but sometimes it's even preferable to have an even lower blood pressure than that. So once you start hitting the 140s, the 150s, you're in a pre-hypertension phase, and once you're hitting 160s, 170s, 180s, you're in full-blown hypertension. Okay, what are these numbers? If you take a blood pressure, it's the top number that is on the machine. How to manage it? You're at home, you don't want to take medication. How are you going to manage your blood pressure? Well, I have 3 simple ways that I explain to my patients, especially after they got out of the hospital, how to maintain a good blood pressure. So these are my tips on how to have a good blood pressure at home, especially if you don't want to take medications. First step is decrease salt. A lot of times we're eating salt and we're unaware of it. So it's not just adding salt to your food. Some foods are super high in salt automatically. Frozen foods are the highest in salt that you can possibly eat. They keep the food fresh and with full color by using sodium as a preservative. So cut out all frozen food. 2, canned foods. If you're eating canned foods, canned vegetables, canned anything, they infuse these cans with salt in order to keep the shelf life for 3, 5, even 10 years. So avoid all canned foods. And the last thing I can tell you is monitor how much you drink. So if you're the type of person, you're going to have 2 cups of coffee in the morning, you're going to have a soup for lunch, you're going to have ice cream for after dinner, popsicles, then you're eating soup, then you're eating anything that turns into a liquid at room temperature is a liquid. So if it's frozen, if it's solid or whatever, if it can turn into a fluid, your body is going to metabolize it or break it down as a fluid. So a lot of people are simply just drinking too much. They drink too much water. And if you already have high blood pressure, too much fluid is definitely going to increase the pressure in your system. So this is me hey, no salt, no added salt on your food. Avoid frozen foods, especially a Marie Calendar or a Lean Cuisine. If that doesn't say low sodium, avoid canned foods like the plague. Pickles, pickle jalapenos, pickle whatever, all of that is full of salt. Even hot sauce. Hot sauce is salt with red dye and some pepper. And then you want to monitor how much fluid you're drinking. So if you're drinking an excessive amount of fluid, whatever you can do, even if you're a drinker, if you're drinking beer, try to drink a shot of vodka and a little bit of soda. Or if you're having multiple drinks a night, try to bring it down as much as you can. And that is how you can start to manage your blood pressure. The last thing I want to say is lose weight. So I'm a little thick right now. Okay. I'm trying to, you know what I'm saying, I'm in the gym. I'm always in the gym. I'm trying to get my little rump right, but keep my little thickness. You know what I'm saying? But some of y'all just too fat, and we're going to have to lose this weight. If you got a big booty, you want to keep it nice and here. Men, if you got a tub belly, you're going to have high blood pressure. I'm telling you. And some of us don't even have to be fat and still will have high blood pressure. And these are high stress, high anxiety, heavy working black men who be on the move, on a mission, and blood pressure high as heck. I remember I had a guy who I have tested several guys for their DOT physical, and they had to come back to the clinic and get rechecked and actually be put on meds because they can't even drive their trucks with their blood pressures. I'm telling you, check your blood pressure. Another thing I would tell you is to check your blood pressure daily. If you have high blood pressure, you want to take a log of what your blood pressures are on any given day. Every morning, take your blood pressure. Yes, it's normal in the morning, but it may be high at night. So take it at night too. Last things last, I want to talk about Medical Allure's new blood pressure cuffs that are going to be on our site starting tomorrow. They are so cute. They're cute and pink, and they're just a wrist monitor. This is the easiest way to take your blood pressure. You just simply put this on your wrist and you hit go. And it's pretty accurate. I use it in the field with my patients. And it's super easy. You just put it on facing this way and hit go. Boom. And you got a blood pressure. Write it down in a journal. Go on Medical Allure today and grab yourself a cute pink blood pressure cuff. We love you. Okay, so I'm done explaining my high blood pressure. I hope that you got it. I hope you got some inspiration to start on your journey of controlling your high blood pressure, because the next thing I'm going to talk about is how it affects your heart. Medical Allure is the cutest little specialty shop for nurses and all the like. Please check our website out at www.medicalallure.com. We're on Facebook, Instagram, TikTok, and we're growing, baby. We're doing it. So thank you so much for joining me. My name is Adrienne, and I hope you enjoyed it. Look out for more vids because they're definitely coming.